You mentioned healthcare costs a minute ago, and I think this is another problem that the federal government is working very hard to create for the states, and this Obamacare. And I'm worried about what that's going to do to the cost of health insurance for our state employees and for town employees, you know, all the municipal employees. What it's going to do to cost for operating the county nursing homes, and what it's going to do to our share of Medicaid. What's the solution to all this? What do you think is going to happen here, and what needs to be done?
Well, what we should do, first of all, is exactly the opposite of the Obamacare. We shouldn't be nationalizing and nationalizing and making a federal program health care. We should be doing the opposite, which is to empowering states and local communities to craft their own programs for covering more lives, improving quality, and lowering costs. And we do that by, again, getting away from the rules and regulations, the heavy rules and regulations that Medicare and Medicaid programs have really superimposed on the delivery system. I'm a business lawyer. One of the areas I practice is in healthcare. So I know enough about it to tell you that there's some real problems with this Obamacare approach. Just look at this, Pete. If you're going to lower the reimbursement and the payment on Medicare, $500 billion over the next 5 to 10 years, what you're doing is shifting the costs of the private sector, municipal insurers, private companies, self-pay. You're making it more expensive to get health insurance through the private sector than you were before, because you're reducing the payment on the part of the federal government for Medicare coverage. I say block grant Medicare monies to the state based on some basic minimum standards that assures that the states will cover the lives of senior citizens who are eligible for Medicare benefits, and then use those dollars to try to leverage a better delivery system and collaborate with local providers, hospitals. Our healthcare system was organically grown. State by state, community by community, people put together their money to create hospitals, to recruit doctors, to develop an infrastructure which is different in New Hampshire than it is in Iowa or California. Let the people of New Hampshire determine the best way to cover lives. Provide for insurance competition and allowing insurance to be sold across state lines. And to make the changes that are going to make people consume health care like they do everything else. How many of us actually go to a place for a usual, clinical test or whatever, a customary one like a colonoscopy, and choose the place because of the cost, because it's a lower cost? Nobody does that hardly, because there's no incentive to do that. We need to change the way we pay for health care, and I want to work with state and local leaders to come up with a way of empowering the states to do this, not taking the power away from them and bringing it to Washington. The agenda here is nationalize health care. There's no doubt about it, and that's the path we're on.
Yeah. Well, it sounds like you and John Stephen would work very well together, since he was chairman of Health and Human Services and now running for governor.
We certainly would, and I would want to work with the people back home in New Hampshire to develop the best strategies from a national perspective that will allow New Hampshire to deal best with providing health care services to citizens. And it takes creativity, but it doesn't take Washington planning. I can assure you that. I would, every day of the week, prefer to know what the people of New Hampshire would suggest as a solution, and I would go with that every day than I would with a Washington bureaucrat who's some sort of an expert. They're not experts about what it takes in New Hampshire to provide quality.